And so I was listening earlier, and I see that this segment is on COVID-19 vaccination. I'll go ahead and share my screen with you and talk a little bit about COVID-19 vaccination. Just a note that you may see some repetition here and from the previous some of the previous presenters. And so what I will do is probably go through a little bit more quickly and just highlight some certain areas. The one thing I know from doing all these presentations is that some information is worth hearing again, especially to the ears that are not, not that familiar with some of the terms or the science. So what I'll do, I'll go through pretty quickly, and then of course I'll be available with the other presenters to answer any questions that you have. So with that, let me move forward. Let's talk a little bit about how vaccines work. I'll probably just go quickly over the leading COVID-19 vaccines. I know Dr. Ioanni talked about efficacy and safety, so I won't spend a lot of time on that, and I'll leave that time to the question and answer. And I'll also look at some of the common questions and myths surrounding COVID-19 vaccine. Again, I think they're always worth discussing a second time. This is my famous picture of myself getting my COVID-19 vaccine. I usually like to talk about that. A little story. Last week, Saturday, I had the pleasure of talking with a church group in Jamaica, actually, over by Zoom. They asked me to talk about COVID-19 vaccine because they just received their first shipment of AstraZeneca, and you know about AstraZeneca in the news, causing blood clots, and several countries pausing the distribution of AstraZeneca in their countries because about 30 individuals developed blood clot after receiving the AstraZeneca vaccine. And so they received their first shipment of vaccine last week, I believe March 10th, and they were really scared. So they asked me to talk with them about COVID-19 vaccines and the science behind it and all of that. So that was pretty interesting. They are, again, like I said, where we were around December of last year getting our first shipment of vaccines. So this is a picture of the first person in Jamaica that received their COVID-19 vaccine, and on Wednesday, March 10th. So that's just to let you know that although we've had these vaccines since December, there are some countries who are just in the beginning stages of getting vaccinated. So I'll talk a little bit about how vaccines work. Before I do so, I want us to remember that vaccination is one of the 10 greatest public health achievements since the 1900s. And so we continue today with newer and better technology. So when did we start vaccination to protect against vaccine preventable diseases? Well, most of us, or all of us, remember our history. Edward Jenner, what he did was he invented the method to protect against smallpox in 1796. And if you recall, what he did was he removed material from the blister of a cowpox, and then he inoculated it into another person's skin. And this was arm-to-arm inoculation, one of our first experiences with vaccination. And so we do know that vaccines to prevent diseases are given to millions of babies, children, adolescents, adults, all over the world, and they have been demonstrated to be effective and safe, as safety has always been our primary concern. So how do vaccines work? Well, vaccines work by mimicking the infectious bacteria or viruses that can cause disease. The vaccination, what it does is it stimulates the body's immune system to build up defenses against the infectious bacteria or virus without causing the disease. The parts of the infectious organism that the immune system recognizes are foreign to the body, and these are called antigens. And so vaccination exposes the body to these antigens. Some vaccines, as you heard earlier, I believe, contain weakened versions of a bacteria or a virus, and other vaccines contain only a part of the bacteria or virus. Some vaccines contain only the genetic material for a specific protein and direct the body to produce a small amount of that protein. The body's immune system reacts defensively once it detects this protein. So after vaccination, the immune system is prepared to respond quickly and forcefully when the body sees the real disease-causing organism. So that's basically how vaccines work. You heard about how vaccines were developed so quickly. The COVID-19 vaccine was developed quickly. What happened is that the transition between clinical phases 1 through 3, were shortened and accelerated. And so that while the vaccine developers were waiting for FDA approval, they were actually working on manufacturing vaccines so that as soon as they received the approval, they were ready to go. So that's pretty much how they were able to produce the vaccine so quickly, in a nutshell. There's more to it, but that's in a nutshell. Okay, so we talked about the vaccines under emergency use authorization. I'm not going to go into all of that, but we know that we have the Pfizer and Moderna, which are mRNA vaccines, and the Johnson & Johnson. And actually, AstraZeneca has not been approved as yet, but they are getting ready to ask for approval through from the FDA. We're not there as yet. Okay. Alrighty. So I'm going to skip through all of these because I know another presenter talked about that. We know about the vaccination side effects. One of the parts of my talk that I'd like to emphasize is that when we have these vaccination side effects, it's actually an indication that our bodies are responding or actually building immunity against the virus. And so it's not necessarily a bad thing when you get the side effects of the vaccine. It actually means that your body is working to develop antibodies against the virus. Okay, so here are some questions that I have seen a lot. Matter of fact, yesterday I was at the we partnered with Children's Hospital LA. Dr. Vargas gave me a phone call last Friday, or I think last Friday. It's a blur. It's actually a blur. Because over the weekend, I worked with Children's Hospital LA, and by Monday, we had 12 volunteers. We had identified a location, which was the Macedonia Baptist Church, and we had everybody on board. We were ready to go. I did a site visit on Monday morning with my contact at the Marie Green at the church, and on Wednesday, Children's Hospital LA's representatives made a site visit, and then by Thursday, we were set up and ready to go. As I was walking through and observing the folks who were waiting their 15 minutes for to see if they had any initial adverse reactions, one gentleman walked up to me and said, "I just got my vaccine. Will I will I take it home and then contaminate my family? Will I transmit this disease, the virus, to my family when I get home?" And I quickly told him no. No, the vaccine does not give you the coronavirus, and you do not need to wear a mask in your home, but you continue to wear your mask when you go outside and continue safe distancing and all of that. And this indicated to me that there are still misconceptions out there. And so we still have to keep talking about what vaccinating or what it really means to be vaccinated against a virus. So one of the questions is, how long does protection from COVID-19 last? Well, we do not know, but what we do know that natural protection, natural immunity lasts about 6 months. So if I had contracted the COVID-19 virus and got sick from COVID-19, then I would have developed some natural immunity, and my natural immunity would last about 6 months. However, being vaccinated with COVID-19, the COVID-19 vaccine gives us added immunity, and the immunity that you receive from the vaccine is substantially longer than the immunity you receive by natural immunity. So for those people who say, you know what, I just want to get and there are folks who say, I just want to get COVID-19 and get it over with. If you survive COVID-19, yes, your immunity will last about 6 months, some more, some less, but that's the information. When do we reach herd immunity? About 70 to 80% of folks having received the vaccine or in our population, we will probably reach herd immunity. Yes, you do need to wear a mask after you've gotten your 2 doses of vaccine. And we talked about having to get vaccinated or recommending vaccination if you've already had COVID-19. I know the previous speakers spoke about some of these as well, and so I won't go over that. And so pretty much, I just want to circle back around to really quickly what we have done on campus to help to keep our community safe is we went on a lockdown on our campus closure in March of 2020. By September, we started testing, and between September and now we've tested over 4,000 folks. We've only had 15 positive from our testing. That is less than 0.1% positivity. And so we were able to implement all the protocols that we implemented on campus, were able to protect us from transmission on campus and help mitigate COVID-19 transmission on campus.
All right, Dr. Santana, please, you have 2 minutes more.
Yes, and so that's pretty much all I have. We're looking forward to opening up the campus a little bit more during the summer semester, keeping all our protocols in place, and encouraging everyone to seek and get a vaccine when it's your turn. So thank you very much, everyone.
Thank you so much, Dr. Santana.